welcome everyone to another episode of Talk with a Doc. My name is Janvi, and throughout this series I will be talking to doctors of different specialities and those at different stages of the medical journeys to learn more about the variety of opportunities within medicine. In today's episode of Talk with a Doc, I'm going to be talking to Dr Rakesh Sharma, a cardiologist working in London.
Thank you so much, Dr. Sharma, for sparing some time to talk with me today. I know how busy you are with all of your different clinics and things, so I'm really grateful for this opportunity.
My pleasure. Thank you for asking me.
Thank you. So to begin with, what was your training pathway like? How did you get to the position you are now in?
Okay, so it's a very good question. So in terms of medical careers, the different stages. So obviously you have the undergraduate phase when you're developing your knowledge base, and during the undergraduate career, it's important to try and keep an open mind.
Mm-hmm.
I know we started off in medical school thinking they're going to be, neurosurgeons in day one, and very often when they actually do the job as a junior doctor, it's very so the first part of the training pathway would be at an undergraduate level. When I became a junior doctor, I kind of very quickly knew I was going to be a surgeon, but again, I tried to keep an open mind. But very often, you're encouraged not to make your mind up until you've actually done the surgical jobs and the medical jobs as a junior doctor. And then when I did my kind of more senior training, it was quite clear that I was narrowing it down to cardiology.
Okay.
And at that stage, they were different. So in order to get into a cardiology training post, you had to have done some research in that area,
right?
In formal research.
Mm-hmm.
Now it's slightly different. So once you've done your junior doctor training, if you like a specialty, you apply for a number, and then you get the training post, and then you do your research, halfway through doing your training. Mm-hmm. So when I did my research, it was actually before I started my cardiology training, and I did my PhD in cardiology.
Right.
And so that was part of Impitch at the Royal Brompton Hospital. So it's a 3-year PhD, and then after that, I joined my cardiology, and which was a 6-year post.
Oh, okay.
So you can see, so I qualified at the age of 24 as a junior doctor,
Mm-hmm.
as a house person, and then doing junior doctor training for 2.5 years.
Right.
Then PhD for 3 years,
Mm-hmm.
and then cardiology training for 6 years.
That sounds like a great journey. You had lots of variety there as well. Knowing that you did do your PhD, what was it like to balance studying for a PhD and doing all of that research, as well as practicing as a junior doctor and as a doctor?
Yeah, so that's a good question. So when I did my PhD, because it's a formal period of research, it's a requirement not to do too much clinical. So especially the university will require that. So in Imperial College, they've got a requirement that you shouldn't be doing more than half a day clinical, because otherwise you can't spend time on your research. So most of my time was actually doing research. I did do an outpatients clinic because I knew that I was going to be a clinical doctor rather than an academic doctor purely. So I did do a clinical week just to keep my hand in, but actually most of it was actually academic.
Oh, I see. Okay. So afterwards, though, would you have had the opportunity to do both academic side of medicine as well as the clinical side?
Yeah, so then when I rejoined my training program, then that was full-time clinical, but obviously I carried on with some research aspects, but when you're doing a full-time clinical job, it can be challenging. The programs have changed nowadays. So when I did my PhD, it was back in 1999 is when I started, and then 2002 is when I finished. So nowadays, if you are keen on doing an academic specialty, then you apply for an academic training post.
Okay.
If you want to do a clinical specialty, you do a clinical training post. So that didn't exist when I applied for it. But I remember when I came to the end of my cardiology training, I was quite clear I wanted to work in a teaching hospital. And then the question rose, was I going to be working in a teaching hospital as an academic professor type person or as a clinical cardiologist in the teaching hospital? So because my main passion is clinical, and I wanted to carry on with my academia, but not as my main focus. That's why I applied for a clinical cardiology post at a teaching hospital.
Great. So does that mean that you still get to teach some students in the teaching hospital?
Yeah, exactly. So the Royal Brompton Hospital is part of Guy's and St Thomas's as of 1st
Oh,
of
right.
February.
Yeah.
It's actually formally part of Guy's and St Thomas's Trust, but it's also got very strong links with Imperial College and now with King's King's College University as well. So we've got 2 universities, and we have medical students who come from both. Obviously, with COVID, it's been different this year. But yes, we normally have medical students who come and sit in our clinics and do ward rounds, and we have formal teaching sessions for them. And also, we teach junior doctors all the way through up to the kind of consultant level. And because we're fortunate that we are what we call a tertiary level hospital. Primary care is basically GPs care. Secondary care is our specialist hospitals, DGHs, and then you've got tertiary care, which is where you have super specialist hospitals like ourselves. So to get quite senior trainees at the end of their career before they become consultants.
All right. Okay, that sounds like a really interesting line to continue your clinical studies while being able to have the opportunity to teach as well. You said in the beginning that you definitely knew you wanted to go to surgery as you were training. So what drew you towards surgery over being a physician?
No, I said I want to be a medic, so I'm not a surgeon. So,
okay.
So my kind of interest lay more in the kind of medical side of things rather than the surgical side of things. But having said that, as a cardiologist, we do a lot of operations. So I do operate. I do put in pacemakers, defibrillators. So I do surgical procedures, but I don't do open heart surgery.
Right. Okay.
So cardiology is one of those medical specialties which is very hands-on, procedure-based. So it does cross both fields. But my main reason for being a medic is that it's a lot more kind of, I think, academic and actually more relating to making a diagnosis and how to treat patients using medicines. Whereas with surgery, yes, you have academic specialties, obviously, but it's more about procedure-based, hands-on based treatment rather than tablets and drugs. And the academic side is often less rigorous than a physician.
Right. Okay. So is that what drew you towards towards cardiology, because you knew you had the opportunity to stay on the medical side of things, but also have the chance to dirty your hands and take part in some surgery as well?
Yes, and also within cardiology as well, it's a huge specialty. So 20 different subspecialties. So
wow, right.
arrhythmia management, coronary management, heart failure management, and then rarer conditions as you work in tertiary hospitals. So it's a huge variety. So my working week every day is completely different.
Oh, right.
So Monday, it's completely different. So Monday morning, I'll start with a kind of multidisciplinary team meeting, 8 o'clock. And that's when we talk about patients with rhythm problems, who make pacemakers, and then after that, do a ward round with the team.
Right.
And then see patients with the team, and then have an outpatients clinic. On another day, I'll maybe in operating theatre. On another day, maybe research time, teaching, etc. So every day is different. That's
really interesting, and it's also very exciting to know that your day is not the same, and it's not a mundane pattern. There's always something to keep you, interested within the field. What subspecialty did you choose within cardiology then?
So my main subspecialty is heart failure. So this patients have a weak heart and also rhythm problems. So putting in pacemakers, defibrillators, and then within heart failure, there's a niche specialty called cardiac sarcoidosis, which is a rare condition. But because at the Brompton Hospital where I work, we look after rare conditions, so we see a lot of that. So it's something which gives me a broad base in terms of heart failure, hands-on in terms of pacing, and then a niche area in terms of sarcoidosis.
Oh, okay, so there's still plenty of opportunity to sort of continue your medical development within the specialty as well.
Of course, yeah.
Great. How is it like to strike a good work-life balance? Because hearing from you, it sounds that there's so much to do within your job. It's not just one thing, so of course it must be very demanding. How do you manage to maintain a good balance?
It's a good question. I think most doctors find this challenging because if you're passionate about your job, you will enjoy it and you'll end up spending a lot of time doing your job. But I think it's about being organized. I think you need to be organized, and we're very fortunate that we've got very good ways of doing that nowadays. IT ways of doing it. I remember when I was a junior doctor, very often you couldn't get to see your consultant. Your consultant used to manage everything. Nowadays, as a consultant, I'm directly emailing and liaising with junior doctors all the time. So I think it is difficult to try and get that balance. But I think it's important that if you're doing a busy job, you're not just organized, but you actually dedicate time out so that you are actually a better doctor. I think someone who works all the time, who doesn't take time out, is more likely they're going to have an error or not going to be able to do the best for the patient. So I think the importance of downtime is very, very crucial, no matter how busy your job is.
Of course, yes, definitely. You were talking about the idea of technology and how you're able to email and liaise with your other consultants and junior doctors better. How is that being used in the pandemic? Because obviously, it's COVID has turned everything upside down within the world of medicine. So how has that impacted you specifically as a cardiologist?
So that's a very good question, actually. So over the last year, we've actually adapted very well. So in the beginning, it was quite difficult, and obviously, people weren't used to remote consultations and so on. But nowadays, actually, I feel that going forward will be stronger, and telemedicine will have advanced many, many years within 1 year.
Right.
So, I think there's always been a resistance before about telemedicine and whether or not it would be safe for patients to actually not see them in the clinic. But now we've realized over the last year that actually the vast majority of decisions and clinical recommendations can be made with a video.
Oh, okay, great.
Patients like it. I mean, for example, the sarcoidosis clinic, which I do, we have patients referred to us from all over the country.
Right.
So prior to the pandemic, I'd often have a patient who's come from Blackpool, Southampton, Cornwall. They come to the Brompton, they spend money on transport. Some of them had to come the night before for half an hour consultation. Now they can have the consultation from their home. And sure, if they need to be admitted or if they need to have any specialist care, then that can be provided locally, or we can get them to come to us. But I think going forward, technology will certainly continue to help improve that. Also, in terms of meetings, so every year we do an annual conference, and before it used to be at the Royal Society of Medicine, very posh venue, but very expensive. And also doctors had to take time out of the day to travel to London to attend this Congress. But now what we found is that we're launching our first kind of webinar for the same annual conference, and we've got already 500 consultants who've registered.
Wow, okay.
And we've got speakers from the Netherlands, Italy, the US,
Wonderful.
Canada, France, obviously ourselves because we're chairing it. And they're all going to be contributing. So we've got the best minds contributing. We've got attendees from all over the world, and it doesn't cost anything. It's all done on MS Teams. So it's actually, I think for the future, it opens up opportunities, research and clinical.
I think it's definitely forced everyone to be able to adapt much better. And we've definitely, be it in medicine or any other field, people have definitely learned a lot of skills and a lot of things that they can then take on further after the pandemic's over. Do you see less cases? Do you have less contact hours now because of the pandemic? For example, I know surgery isn't your main thing, but if you were to do pacemaker surgery, for example, is that less in this past year, or has it not been affected that much?
The question is there less general cardiology?
Yeah, as in less contact hours in the hospital and less surgery in the hospital.
Yeah. Okay. So I mean, there were times when actually we were rotated at the beginning to ITU. So this time last year, there was no cardiology. It was all in shifts. So when you weren't doing a shift, you were at home. But now, obviously, with all the pent-up demand, all the patients who have not had treatment done, it's got very, very busy. And thankfully, we'd seen less because of the vaccine program. So it is there's more kind of face-to-face time. There's more. I'm going into hospital every day, for example.
Right.
So that's back to normal.
Back to normal. Must be very busy now as well. After not having to do that.
It's good to be busy, not doing COVID stuff. Yes.
Yeah, that's good. Also, I know that you work both privately and within the NHS. So what was that experience like to begin privatising as well as continuing to work within the National Health Care System?
Yeah, so the UK healthcare system allows time allocated to private and NHS. So it's something which has been part of the NHS as it was first founded. So yes, we have designated times in the week when we are allowed to do private work, and you negotiate that as part of your job plan.
Okay.
And so it's all explicit. And then during the time when you do private work, it's often clinic-based, the vast majority. And we see patients in clinic, also remotely as well.
Right.
So, for example, I've just finished a private clinic today at home. via remote video link. So yes, it is a matter of getting the right balance. But very often, even if we're allocated to do a private clinic, we'll still be managing our NHS inpatients. So as a hospital doctor, you don't switch off when you're doing private clinic or when you're on call. You continue to be responsible for your inpatients. So it is, again, coming back to what we said before, you need to be organized. I think one of the key skills, which the many skills you need to have to be a good doctor, a successful doctor, is to be able to manage stress as well.
Yes, of course.
So if you're going to be working hard and you're going to be seeing a lot of patients and you've got a busy workload, it's important to know not just how to have downtime, but how to deal with stressful situations, how to manage it, how to not let it affect you, because it's a very kind of rewarding career, but it does take a lot of time.
Yeah, I can see that. I mean, the fact that, all of these things you mentioned today while talking to me definitely seems like you're very busy to be able to manage it all, and yet you make it work. So that's really inspirational. What's the biggest piece of advice you'd give to anyone who'd want to enter cardiology, seeing that there's so much opportunity, so many things to be able to achieve? What's the one takeaway you have had over the years?
I would say it's a great specialty. It really is. And within cardiology, there's so many different subspecialties. So it's not just one kind of career path.
Great.
Academic, you've got clinical, you've got imaging-based cardiology, you've got hands-on-based cardiology. So if you don't like doing operations, you can still be a great cardiologist.
Okay.
Yeah, it's not just all surgery. The majority of it isn't actually.
Is it? Okay.
And imaging has actually taken off big time. So cardiac MRI, cardiac CT, echo, and a lot of the imaging is very high end and is crucial to managing patients. And nowadays, medicine is all integrated, so it's all team-based working.
Of course.
One of the days when he was a consultant who made all the decisions and everyone just followed. Multiple consultants, you've got multiple specialist nurses, you've got radiologists, you've got pharmacists, everyone linking in to a meeting, which is known as an MDT, multidisciplinary team meeting, and we provide a kind of a consensus recommendation for the patients. So it's a great specialty, cardiology. It is a tough one because a lot of people want to do it, so it is very, very competitive. But if you do want to do it and you set your mind to it, there's no reason why you can't be successful.
That's great. Thank you so much for that. Really useful information and definitely inspiring me. Cardiology was one of the lines that I was thinking about earlier on, and I'd really love to sort of go into it. And after hearing from you, it does sound like a really wonderful specialty and wonderful line to go down. So thank you so much, Dr. Rakesh, for talking to me today. I really found it very insightful, and I'm sure everyone else who will watch this later on will also be very grateful for your time today. Thank you.
Thank you for the opportunity. Thanks so much.